Good morning, everyone. Welcome back to my channel. Today, we'll be talking about diabetic and periodontal disease. And this video can help also dentists as well as patients to be aware of some of the most important latest finding about adult diabetic, and how it's affect the periodontal disease and as well as your overall health. And statistics indicate that there's 60% of diabetic mellitus have moderate and a severe periodontal disease. This is the bilateral relationship between periodontal disease and uncontrolled diabetic mellitus, mean that each make the other worse. This is a dual epidemic. It's very important for a dentist to be aware that if you see the diabetic patient, you have to be watching out their sugar. The other fact is that 60 to 70% of U.S. adults population have active periodontal disease. 1/3 of U.S. population is diabetic and pre-diabetic. Most pre-diabetic and diabetic patients don't know unless they are diagnosed and properly informed. These are information that are very important for dentists to be really aware and talk to patients, because after all, they are your patient, and sometimes you do major work, there can be a problem there later on. Why diabetic turned epidemic so badly lately? Because of the overexposure of sugar in the food that we eat, and it's also your constant eating of sugar or drinking sugar fluids. It can cause insulin resistance, and eventually it turns your body into diabetic. So watch out with your sugar. Don't eat too much carbohydrate or drink a lot of sweetened stuff. What is the bilateral relationship between diabetic and periodontal disease? Diabetic promote periodontitis, and the other way around is true as well. So if you have periodontal disease, you might have diabetic. If you have diabetic, you might have periodontal disease. So it's the same similarity of the cause and effect. What can we do as a dentist? You just have to be aware of 20% of your patients have diabetic. Almost 80% of your patient have pre-diabetic, but it's not diagnosis. You have to talk to the patient, encourage them to do A1C tests. I'll be talking to you more about that. The evidence suggests that, if you have periodontal disease, one of the clinical manifestation of diabetic, so learn it and check out, tell your patient. So dentist role will have to recognize that diabetic risk factor as well, the oral side of diabetics such as gingivitis, periodontitis, dental caries, candiditis, oral infection, neurosensory disorder, taste and swollen. All of that can be related to diabetic. Understand the bilateral effect of diabetic and periodontal disease help diabetic patient to gain both sugar control and gum stability control. So what is A1C test? The really simple test. It's just a test to find out in the past 2 to 3 months of a patient what was their average of hemoglobin sugar level, and this number can go from from 5 to somewhere 5 to all the way to 8 or 10 or 9, and the higher the number, the bad that would be. For example, above 8 is really bad. It's more than 7, you have to watch out your diet and talk to the patient. And it's 5 to 6 is somewhere pre-diabetic, and less than 5.7 is below, is considered normal. So these are the mechanism that you learn, and you be aware, and you check your patient blood test. So diabetic patient can have high risk of dental implant fail. You put the money in, invest into the dentistry, but it failed because they have periodontal disease, and also they have uncontrolled diabetic. And why? Because study indicate that diabetic patients have, especially under control diabetic, have very delayed healing process after surgery. That's why the implant can fail. The long, complicated cosmetic work can fail. How do we manage your health? The best thing to do is watch out your diet and continue doing exercise. Thank you for watching. I hope that next time I will talk to you more about how you really control your A1C number by looking at your number and what you do to manage your number and control your A1C to the best of your ability. Most of the time, when you go to a doctor, they don't have time to explain to you about how to control your A1C number. Thank you for watching. I'm hoping this video has helped everyone. Thank you very much. Subscribe my channel. We'll continue talking to you more about this problem in America. Thank you very much. America as well as around the world, by the way.